it's Sweetie Abochi bringing you AM News on the AM show, and details now. The friction between Chairman of the Appointments Committee, Bernard Ahiafo, and Ranking Member Alexander Afenyo-Markin shows no signs of easing. The two clashed again, this time during the vetting of Supreme Court nominee Justice Hafizata Ameloboba over claims of interference and threats of political payback. Tensions escalated after Majority Leader Mahama Yariga stepped in to follow up on a question about salary sanctions for appointees who missed the President's April 17th asset declaration deadline. James Aveji was on that beat and reports.
The first disagreement between Minority Leader Alexander Afenyo-Markin and Chairman Bernard Ahiafo came up when the chairman admitted a follow-up question from Majority Leader Mahama Yariga on Afenyo-Markin's probe as to whether or not there was wrongdoing when President John Mahama imposed salary restrictions on appointees who violated his earlier April 17 deadline for declaring their assets.
Chairman, this strategy by the majority, that they have their time. When it gets to my time, then I have follow-up. Anyway, I will yield to you. If you, Chairman, would want to allow these things, no problem. Follow up. And you think that you'll be distracting me. I don't.
Honourable members, I believe everybody must be treated equally, particularly the leaders. There are instances where the minority leader called for a follow-up question and has been granted the floor to ask a follow-up question.
The ranking member again registered his protest when Bernard Ahiafo insisted that the nominee should not answer a question to the same matter which he believed was answered earlier. The two grew furious, with the chairman insisting that he cannot be intimidated by the posture of his ranking.
I cannot be intimidated by you. I'm a man with indomitable spirit. I still rule that the question has been asked. The nominee will not answer this question again. Pose another question.
Finally, the committee made headway as a nominee, Justice Hafizata Ameloboba established that there is a void created by the Constitution when it failed to provide specific sanctions for failure to declare assets within a specific period.
Honourable Chair, as has been stated, that there is no punishment regime, then what it would mean is that there's a lacuna in the law, and that must be addressed. It would need some deliberation on how this should proceed. For instance, presently we have the Constitutional Review Committee sitting. So if proposals are made to it on how to proceed, it can compile these proposals for the necessary action to be taken.
On other matters, she disagreed with assertions that Chief Justices influence the outcome of cases through the choice of justices they empaneled for some particular cases.
I believe that in the empaneling of judges, the Chief Justice performs an administrative function. Now, this administrative function is a function that has been given her by the Constitution. And I do not believe that it would or should influence the kind of decisions taken on the bench, because the Supreme Court justices of the bench are experienced, independent-minded jurists who should be able to take independent decisions.
The committee rose without vetting the final nominee, Justice Kwekutewia Akabuafo, even though he was scheduled for Wednesday, June 18. It is unclear when that vetting will be done. James Aveji, Parliament House, Accra.
Away from Parliament, emergency efforts are underway after fire ravaged key sections of the National Public Health and Reference Laboratory at Kolebu Teaching Hospital. Testing areas, storage rooms, and account offices were all affected, according to the Ghana National Fire Service. Director General of Ghana Health Service, Professor Samuel Kaba Akoria, who visited the scene, called it a major blow, but says contingency plans and relocation efforts are already in motion. We'll tell you more in this report.
According to the Ghana National Fire Service, the incident occurred around 10:30 p.m. yesterday on Tuesday night. the Ghana Fire Service was able to get here around 12 midnight, according to DCFO Daniela Mausi Into Sapon, who is the Chief Fire Officer for the Ghana National Fire Service. The information that we've picked from the ground, according to our assessments, is that about 5 different rooms housing the accounting office, a chemical laboratory, and also other stores were ravaged by the fire.
Yes, when you came here, you see, we finished quenching all the fire. And there are pockets of fire, so we are trying to cool it down. We got here by exactly 12:15, 12:30 thereabouts. We were able to put the fire under control. And I went to the Office of the Records and Public Health and Reference Lab. And we were able to contain their library, but for the accounts office, their stores, admin, and lab, it's totally down. It was close to the diabetic center. That place too, we were able to salvage, and there was no problem there.
So with regards to the cause of the fire, she can't confirm what really caused the fire at this point, but investigations are underway to ascertain what really may have caused the fire.
No, we have to investigate first. We can't make a hasty conclusion. We can't assume. For fire service, you don't assume. You make sure you say the right thing. So we'd have to give us time to finish the investigations and then get back to you.
The fire service faced a number of challenges when they got here. One of the major challenges was the hydrants at the facility, which is far from them, and also the highly inflammable chemicals that are used in the chemical laboratory. Director General of Ghana Health Service, Professor Samuel Kaba Akroria, was also at the scene to assess the impact of the fire outbreak at the National Public Health and Reference Laboratory. And he reviewed that a number of measures have been put in place, including reallocation of the people in there.
There are a lot of things that we are not able to quantify yet because some part of the archives have been burnt, and we're just waiting to have a comprehensive report of the rest of the places so that we can take a decision. As I said, this is something the fire service is going to recommend. They will take care of that part, and I will take care of the Ghana Health Service component. That's the human resource and reallocation plans and all that. Once you have this situation, you move into the field with a plan to reallocate people. So we've already identified a place where the people will be sent to. The good news is there are no casualties. So we are extremely grateful that we don't have anyone who got himself burnt.
Reporting for Joy News, Collins Frimpong.
The Metropolitan Chief Executive of Cape Coast, George Justice Arthur, has expressed satisfaction with the mandate given to the Metropolitan and Municipal Assemblies to take charge of sanitation issues within their jurisdiction. Speaking at a high-level stakeholder engagement in Cape Coast, the MCE stated that the Assembly is committed to prioritizing sanitation, especially after the President announced that Assembly's performance will be assessed based on their sanitation outcomes. More in this report.
The precaution here is that whoever comes to power will stick to the programmer tool for the next 8 years.
The stakeholder engagement was a deliberation of proposals from stakeholders made up of academics, traders, drivers, religious groups, media personnel, and concerned Cape Coasters to improve transportation, tourism, health, and sanitation in Cape Coast. Stressing on the need for community engagements, the Metropolitan Chief Executive of Cape Coast, George Justice Arthur, emphasized the significance of including communities in Cape Coast to ensure the success of the 8-year development plan.
The 1992 Constitution, those who proposed, who wrote the Constitution, are the ordinary people on the street. And they had the framework for us to be using now as a Constitution of the Republic of Ghana. So it will not be out of place to go to the people, solicit their ideas, and we have one idea, we bring it together and have a full-fledged 8-year development plan that is going to guide us in Cape Coast here. After hearing that such a news, in fact, it was the happiest day in my life when I heard the president has cancelled Zoom Lion's contract. After we assumed office, or I assumed office as a Metropolitan Chief Executive, it was very tough for me. Whenever I call on Zoom Lion, they would tell me their car is broken down and all that. So we have to, assembly have to improvise, make sure that we get something to evacuate our refuge. So it was a headache. So it was a very happy situation, a happy moment when President announced that he has cancelled Zoom Lion contract. We are going to take our destiny into our own hands and make sure, because it's one of the assessments that the President is going to assess we, the MMDCs, and we are going to tackle this sanitation issue seriously in the metropolis.
The Cape Coast North Member of Parliament, Dr. Kwame Namintanyako, urged intentionality in ensuring the enhancement of tourism in Cape Coast.
Apart from the Cape Coast Castle, there's nothing more that we can talk about in Cape Coast that should warrant us to be called the hub of tourism. So since we are yet to develop a 8-year plan, there's the need for us to be intentional. We have a deliberate attempt of making sure we can add other things that can really befit that particular accolade as the hub of tourism.
From Cape Coast, Abigail Lisel-Nkrumah reports for Joy News.
From Cape Coast, let me take you now to Tamale. Because some students at the Tamale Islamic Science Senior High School are spending nights in a damaged dormitory after a weekend windstorm worsened an already weak structure. Deputy Education Minister Dr. Clementa Park, who visited the school, directed authorities to request a structural audit from NADMO to assess the safety of the building. Martina Bugri tells us more.
The building, which has developed serious cracks, pale paint and broken windows, hints of years of abandonment. It currently houses about 150 students. Inspecting the project, Dr. Park emphasized the need for the audit before determining the next course of action.
Indeed, I have seen that most of this one-story building, the upper part of it, has been ripped off by a rainstorm. As was rightly indicated by the headmaster, this has resulted in the students who hitherto be occupying the upper floor having to join their colleagues on the lower floor. This is making an already bad situation even worse, and that clearly is not conducive for the students, and it doesn't enhance effective teaching and learning.
The headmaster of the school, Mohammed Isifu, said the students are currently being accommodated in other rooms with about 40 students per room, far exceeding the ideal 15.
The building that is most affected, but the girls' dormitory, which is at the other side, it affected a portion of it as well. But immediately, management had to request our school carpenter to see what effort he could do to put that particular one in shape. So we asked that he should do it. And when you can see from here, you can see it at that far. I think that he has been able to do some, but it's not yet complete. So the windstorm also affected the girls' dormitory as well. So ideally, a room is supposed to accommodate, normal standard is supposed to be 15 thereabouts. But in our current situation, a room occupies more than 40 students.
Regarding feeding in senior high schools, Dr. Park mentioned that new modalities are being implemented to address issues of poor quality and food shortage in schools.
Yes, there are always going to be bad nuts here and there, but generally, the reports have been positive. And going forward, we are working with CHAS and other stakeholders to see the best arrangement that would ensure that there is timely provision of food in terms of perishables and non-perishables.
Dr. Park, as part of his visit, was at the Tamale Senior High School, where the BEC candidates are writing, Islamic Senior High School and the Sakasaka Junior High School.
In other news, the Ghana Health Service has taken delivery of more than 90 motorbikes from the U.S. Agency for International Development, USAID, to boost healthcare delivery. Although several USAID operations remain on hold, Ghana, one of its long-standing partners, continues to receive support. At the handover ceremony, USAID Ghana Director Kimberly Rosen noted that the motorbikes will enhance access to healthcare services nationwide. There's more in this report.
Over 90 motorcycles to the Ghana Health Service and another 14 motorcycles to the Christian Health Association of Ghana. These motorcycles that we just mentioned will help healthcare workers reach communities with life-saving services such as antenatal care, malaria prevention, nutrition counseling, and child welfare services. Community outreach is really the backbone of Ghana's primary healthcare system, but without that reliable transport, frontline workers can't reach the households that really need it most. So today's donation of motorcycles will help close that gap. Over the past 3 years, the United States has donated over 300 motorcycles, 22 vehicles, and over 3,000 electronic tablets to the Ghana Health Service to enhance health service delivery for the most vulnerable.
A deputy director in charge of clinical care at the Ghana Health Service in the Northern Region, Dr. Kwame Techi, is advocating for men's mental health. He says the occasion should be used as a platform to spotlight men's well-being and encourage open conversations about stress, sadness, and burnout. Speaking at a health screening event organized by the Glory Hill Women Empowerment Foundation, Dr. Techi emphasized that prioritizing men's mental health is crucial to breaking the stigma associated with seeking help. We'll tell you more in this report.
Health screening offered the opportunity for men from all walks of life to gather at the EP Church Warders Canteen to seek medical care. Speaking to the media, Dr. Techi noted that societal expectations placed on men are driving many to depression, but the stigma surrounding mental health prevents them from seeking help.
Depression is actually something that is high among men, but because of our sociocultural context where men are said to not to show weakness, so they tend to harbor this within them, and by the time it is discovered, it is then too late. Depression is quite high, and then there are a lot of responsibilities on men, that is to work and to be able to provide for the family and to be able to support the family. You know that men actually are the lead, are the heads at home, and so there's a lot of pressure on them, and this burden sometimes tend to affect them in affecting their mood.
The CEO of Glory Hill Women Empowerment Foundation, Gloria Abew, acknowledged the importance of men's health issues, stating that whilst their focus is on women empowerment, men's health should not be overlooked.
If we can always get men to take care of themselves, to take care of their health, we are concerned about women, but when our men are not in good health, it will be difficult for us to also live a happy life.
The Northern Regional Psychiatrist, Dr. Susan Annan, highlighted that stress, depression, and anxiety can predispose men to substance use disorder.
People with anxiety sometimes experience tremors, they have palpitations. That's a sensation of their heart beating harder and faster than the way it used to be. They can have panic attacks. They can have a sensation of lightheadedness and many other symptoms. And for a while, they may seem to be getting some relief.
Let's get into our business update now and do some business story. But first, a look at the currency market. Well, so for our first business story, consumer advocacy group CATS International has made a passionate appeal to the Bank of Ghana to urgently phase out monthly ATM card maintenance fees, particularly for customers who use their bank's ATMs exclusively, aligning Ghana with global best practices. Speaking to Joy Business on the matter, the West Africa Regional Director for CATS International, Apia Kusi Adomako, admonished the central bank to mandate up to 4 free third-party ATM withdrawals per month to shield consumers from fees when their bank's machines are unavailable.
We want Bank of Ghana to mandate the banks to provide up to 5 free third-party withdrawals for every month. Number one, that is in the short term. In the medium term, the banks should be able to waive off ATM withdrawals in its entirety, and also consumers should not be made to pay any maintenance fees on ATM. And finally, the Bank of Ghana should also penalize banks whose ATM machines break down to ensure that the downtime will be reduced.
In other business stories, the year-on-year producer price inflation in ex-factory prices for all goods and services reduced drastically to 10.2% in May 2025, all the way from 18.5% in April 2025. This is the lowest rate recorded since November 2023. It also means that the average prices that producers received for their goods and services fell by 8.3% in May 2025, from April 2025. We'll tell you more in this report.
This came to light after the Ghana Statistical Service released the producer price inflation for the month of May 2025. It actually measures the rate at which the price received by domestic producers for their goods and services rises or falls over a period. The data from the Ghana Statistical Service showed that the producer price inflation rate dropped by some significant margin to 10% for the month of May. For a month-on-month comparison, prices actually dropped for most of these manufacturing firms. For some, this fresh data raises a lot of questions why some industries and manufacturing firms are yet to reduce their prices or pass on these benefits to consumers, coming on the back of the cedi's sharp appreciation against the dollar, especially for those firms that source majority of their imports from outside.
So that's for the business news. Let's wrap it up with the commodity market. That's it for the AM News. Coming up next is AM Sports, and Haruna Mubarak serves you that.